Welcome to Olympian Water Testing, giving you the best in water analysis. Today we're looking at the NIH National Library of Medicine and what does mercury exposure do, medical and public health issues. So we need to understand that. So if we're exposed to mercury or if we suspect it's in our water supply, we can act accordingly. So mercury exposure is widespread in the United States with methylmercury, and that's what happens when there's mining activities or when mercury gets into the water due to some environmental cause or something else, maybe disposal of a product, and then mercury in the water interacts with bacteria, and that ultimately creates methylmercury, which accumulates in plankton and is then eaten by fish and then bigger fish, and it bioaccumulates. As a predominant chemical species, fish and shellfish as the source, and the use of more advanced diagnostic techniques and application of population-based risk assessment methodologies have assisted in addressing the impact of mercury exposure on the United States population. Biomonitoring, particularly through the analysis of blood mercury, provides both population-based data and exposure information that can be informative for physicians. And data from the National Health and Nutrition Examination Survey began in 1999, provided population-based exposure estimates for the United States overall. And methylmercury exposures among women of childbearing age are of particular concern. Because of methylmercury development neurotoxicity, exposures of concern among women are estimated to occur between 6% to 8% of the 16 to 49-year-old age group based on the data from NANES. In 15% of this age group and sex group, if physiological factors such as the degree of transport of methylmercury are taken into consideration, subgroups with high fish consumption, many island and coastal populations, and some individuals following healthy diets can have methylmercury exposure substantially higher than reported among the examinees, and these subpopulations are not likely to be aware of their blood mercury concentrations or the possible health outcomes associated with such high blood mercury levels. The American Medical Association adopted policies that express concerns about methylmercury exposure and advise patient education. Non-neurological risks for adults associated with methylmercury include the potential for adverse cardiac outcomes, have not yet been incorporated into risk assessments. Now, some medical concern of awareness of the need to reduce overall exposure to methylmercury was expressed in a policy issued by the American Medical Association in 2004. The recommendations focused on the improved monitoring of patients' exposures to mercury through the blood, hair, urine measurements, or promoting testing fish for their mercury content, making the data available on sources of mercury, and promoting patient education. So what are some of the things you can do to avoid all of these symptoms of mercury and these problems? Well, one is you can limit fish consumption, as that is the main one. But you can also have your water periodically tested for high levels of mercury to make sure that none of these issues, especially for pregnant women or women who are at childbearing age, are exposed to high levels of mercury in the water.